project titled Hi everyone. Today we are presenting our project titled More Than Care: Turning Volunteerism into Community Impact.
This project was completed at Tarleton State University during the spring of 2026 in partnership with Interim Healthcare.
Our goal was to explore how volunteerism, specifically in hospice care, can create meaningful impact not just for patients but for the entire community. This is also a QR code down at the bottom that you can scan for our handout.
This project was developed across over 4 semesters, including service learning, social welfare policy, social work research, and also capstone.
Throughout this process, our cohort completed over 250 volunteer hours, which gave us hands-on experience working directly with community partners.
There were changes in our group dynamic. We started off as a team of 5, then we went down to a team of 4, then we went down to a team of 3, then we went back to a team of 4. Now we're a duo.
So, this wasn't just a research project, it was an applied learning experience that allowed us to see real-world changes and solutions. Our final portfolio included 5 chapters and over 100 pages of work.
Well, this included research, agency analysis, community engagement, and also our final project deliverables. We partner with Interim Healthcare, an organization that provides hospice and healthcare services.
We analyzed interim's health. We analyzed we analyzed interim healthcare's history, their population they serve, and the services that they provide.
Well, this helped us understand better how hospice care operates and where gaps exist, specifically in volunteer support.
So for our problem statement, the main issue was that we identified is the shortage of hospice volunteers.
Well, volunteers are essential in hospice care because they provide emotional support, companionship, and assistance to both patients and families.
However, many people in the community don't fully understand what hospice is or what volunteers actually do.
Well, because of this lack of awareness, recruitment and retention rates are very low.
This can create more stress on staff and limits the level of care and support the patients receive at the end of their life. So for our problem statement, it is there's a shortage of hospice volunteers, which limits the ability of hospice agencies to fully support patients and families at the end of life. Volunteers are essential to hospice care, yet many people in the community lack understanding about hospice services and the volunteer role. This lacks this lack of awareness contributes to lower recruitment and retention rates, placing more strain on hospice staff and reducing the available support for patients.
Our research aimed to better understand why this shortage exists and identified effective ways to increase volunteer recruitment.
By doing this, we hope to find solutions that could improve patient care and strengthen hospice services overall. We created a survey using Qualtrics to collect data.
The survey included demographic information questions about their experiences with hospice agencies, and whether patients were currently volunteers at certain locations within the interim hospice area.
This helped us gather both general and specific insights about volunteer engagement.
For our literature review, we reviewed 11 scholarly articles related to volunteerism.
These studies included quantitative, qualitative, and mixed method research.
From these methods, we identified 3 key themes: volunteer management, volunteer experiences, and volunteer retention.
These themes helped guide our research and gave us a strong foundation for understanding the issue. During our time with our community partner, we participated in various activities that helped us better understand hospice work.
This included engagement with staff, observing operations, and contributing to outreach efforts.
These experiences helped connect our research to real life practice. So during my time volunteering at Interim, I did a lot of events within different nursing home settings, as well as tuck-in calls. Of course, my favorite thing to do was the events from nail painting. We did a Black History Month um, kind of party thing. It was really fun. We painted birdhouses with some patients, and just seeing them smile and be interactive was really fun for me. And it just helped me feel more meaningful in my volunteer work.
Like some of the experiences that I did included office work, sending birthday cards, correspondence notes to patients. I also had a couple of patients that I visited from time to time, also assisted with painting sun catchers. Uh, what else? Uh, Also did the nail thing. Most of the women patients were shocked that hey, a guy can paint fingernails, but hey, I'm a jack of all trades basically. Our research project focused on hospice volunteer recruitment and factors that influenced it. As you can tell, these are a few of the tests that we did do, like the chi-square test.
We conducted an exploratory quantitative study.
We used self-selection sampling, meaning participation was voluntary.
The survey was distributed to about 250 hospice volunteers across 17 inter-hospice locations.
Over 100 individuals participated, which gave us a strong, solid data set to analyze. For our first hypothesis, it stated that recruitment strategies had no effect on the number of hospice volunteers.
Our second hypothesis stated the opposite, that recruitment strategies do have an effect on hospice numbers,
Well, after finding
volunteer
out
numbers.
with everything that we did, our findings did support the second hypothesis, showing that outreach and recruitment methods truly do matter.
Implications for social work. At the micro level, we found that many individuals simply lack awareness about hospice volunteering.
Social workers can help educate individuals about what hospice is and how volunteering makes a difference.
At the meso level, outreach is key.
Well, our data did show that word of mouth and community events were very effective strategies.
Social workers can collaborate with organizations to attend job fairs, college events, and community markets.
At the macro level, barriers such as paperwork and medical requirements, they can discourage volunteers a lot.
Social workers can advocate for policy changes that reduce these barriers while still maintaining safety standards.
Okay, for our macro project, we did develop a project plan with weekly updates for our class. We did have constant communication with our community partner and our instructor till our partner left the agency. But we did create a video to help Interim track more volunteers.
Even after our community partner left the agencies, we continued to complete the project.
As you can tell, this is our video, which is titled More Than Care, Turning Volunteerism into a Community Impact. If you would like to play that, you can play that. For our,
Project plan. We followed a structured project plan with weekly updates and consistent communication.
well, like I said earlier, this helped keep our work organized and aligned with our goals of getting everything taken care of. And We had a few bumps along the way, but we did get it done with advice from our professor and our community partners as well. One of the biggest things we learned is how important volunteers are in hospice care.
We also learned that awareness is one of the biggest barriers, not necessarily a volunteer's willingness to do it.
Well, this experience did show us how research can directly inform real world change.
And it reinforced the role of social workers as advocates, educators, and community connectors. Thank you for listening.
All right, I just wanted to know if you guys have any questions, comments, concerns, praise, whatnot. Okay. And also, these are a few of the references that we did during our 4 semesters, getting everything provided together. A lot of hard work, but hey, we got the job done.
Craig, I have a question for you.
Yes.
What what do you think has been the biggest changes from semester one till now in your experience with volunteering for hospice?
Well, for volunteer for hospice, one of the biggest things that I saw was the fact that I'm more open to people and helping them out and seeing that, hey, there are people like you and me, they just need someone to talk to.
Yeah.
I know we had Jasmine, I know we had conversations saying that you were nervous about doing hospice when we first started from way back then. But now, how do you feel about working with individuals in hospice care, and also you see how hospice organizations flow?
Yes, that's very true. I'm very transparent. When people ask me that same question, I'm like, because I got in the class a little late, so I wasn't involved in the decision-making process when it came to which community partner we would serve. So once I learned we are doing hospice, I was like, no, like whose idea was this? Why would we want to work around people who are like, at the end of their life? Like to me, it just did not seem like I never thought of myself as a future social worker in that population. But now looking back at it, it's completely transformed my idea and helped me to get rid of that stigma that I had about hospice. Like it's not about dying; it's literally about living and like loving the transition at the end of someone's life. So being able to hold someone's hand, while they're in the scariest moment of their life, or even doing tuck-in calls and just hearing sweet voices on the other end, it was just really a really fun experience. So I feel quite differently.
Okay. Well,
Yeah.
well, that's all the time we have for today. I want to thank you for listening to this presentation. I hope you guys have a great time, and until we see you again.
Thank you.